All right. Good evening and welcome to my YouTube channel. So happy to welcome you once again. Just as I promised you before, that I will be giving us some health tips, important health tips on this channel. Welcome once again. I am Chidebereze. So at this hour, I want to discuss a trending topic in our environment, something that like a normal thing within our environment, and then most people used to talk about it. So I say, let me clear or pass an information about it. It's just a simple word, and then what brings about this interesting topic is because of the fact that I found out that even among some health workers, they talk about the topic and then they misinterpret or misquote it. And that simple word or complex word is just this they call it malaria typhoid. So sometimes you see yourself being on a consultation and then somebody will just come in and say, "Doc, I have malaria typhoid," or "I treated myself last week or last 2 weeks of malaria typhoid," and the person will be like, "And after then, since then, I still have the same symptoms." So first part of this video is just to make you understand that malaria is not the same thing as typhoid. They are basically different things. They are like east and west, far apart from each other. You understand? So malaria itself is caused by a plasmodium. So it's a parasitic infestation or infection. Why typhoid is caused by a bacterium. So you can see that the other one is caused by a parasite, and the other one is caused by a bacterium. And the bacteria that causes typhoid is called Salmonella typhi. But we have found out that within our environment that people used to misquote, and every time somebody has maybe headache, fever, and weakness, or chills, that is cold, the person will say, "I have malaria and typhoid." And then it's like a normal thing in our environment. And then I said, no, let me make this video to make our people understand that these two things are not the same thing. That you have symptoms that look like maybe resemble each other for different diseases, does not mean that you have both diseases at the same time. That does not mean that they cannot coexist. But why I'm making this video is to make us understand that they are not the same disease, and then their treatment modalities they are different. So what is propelling me to make this video is because of the fact that people are now like abusing the word malaria typhoid, and not only abusing the word, they are also abusing the modalities of treatment. And then because you have headache, you have fever, you have chills, that is cold, and then you have weakness, and then you start taking anti-malaria, start taking antibiotics. And then what is even of important or critical in the issue is that most times those people that start taking those drugs, they will even take the low dose antibiotics. In other words, they start abusing antibiotics. Before you know it, they will start developing resistance towards some bacterial infection. Do you understand? So that you have headache, you have chills, does not really mean that you have malaria. There are other diseases, there are other infections that can also give you the same symptoms as headache, as cold, as weakness. Somebody that has urinary tract infection can also have those ones. Somebody that has pneumonia, chest infection, can also have those ones. You understand? So they are not basically the same thing. Now, why am I making this video? Why I'm making this video is this. Number one, when you have symptoms that look like you are having malaria, and you've been on anti-malaria for 2-3 days, and you're not, the symptoms are not resolving, that means you're not getting better. just go to the hospital, go and consult a doctor. Do you understand? Because it's the work of the doctor to actually examine you and know the kind of test he's going to send you, and also know the type of drug or type of drugs he's going to place you on. Not you being at home abusing anti-malaria and at the same time abusing antibiotics. Do you understand? So you see that most people, they'll say, I have malaria, typhoid. They will take malaria and then at the same time take antibiotics. That is a ciprofloxacin, as case may be. And by the time they are coming to the hospital, maybe they were not having a typhoid and they have abused those drugs. Then they would have developed resistance. Another thing is that sometimes they will come and they will present and they will say, doc, look at my lab result, and they will show you wider test, and then they will have a significant wider test, and they will be telling you, doc, treat me of typhoid. Do you understand? Meanwhile, other symptoms which may be suggestive of typhoid or enteric fever may not be there. Just because you have a significant wider test does not mean that you have typhoid. Because somebody that has malaria in the system can also have significant wider test, and that does not mean that the person has typhoid. So there are two different things. And then why I am making this video is so that you that is listening or that is watching this video, you can learn from it, share it to your loved ones, share it to your friends, and at the same time follow me up on this channel, because what I'll be doing these days is to bring up some important health topics and then discuss it, and then some other pressing issues within our environment. Do you understand? So if you have listened to this video, if you have watched this video and you like what you've listened to, subscribe to my YouTube channel and follow me on my Facebook page, which is Chidebereze. That's my Facebook page, and my YouTube channel, which is Chidebereze at same time, the same name, Chidebereze. So subscribe to my channel so that you can be getting updates about health tips and important things, important messages, important information concerning your life, and then other things that will help us to build a better society. So I see that there are a lot of misinformation that is going on within our health system. You understand? So my dear, as you have listened to this message, don't abuse antibiotics. If you have been on drug for 2-3 days and you're not getting better, go to the hospital. Go to a trained medical personnel. Let the doctor examine you. Because sometimes from clinical examination, the doctor can even know what is happening to you and place you on empirical treatment while you are going for investigation. And not you being at home and administering some drugs to yourself for a long time and then developing resistance. By the time you are not presenting, we are not placing you on higher grade of antibiotics, which most times, because you have abused different antibiotics, the organism that is already in your system would have developed resistance to those antibiotics we're going to place you on. So I encourage you, as you watch this video, learn, number one, if you have symptoms like headache, you are like fever, like cold, and you have started some antibiotics, anti-malaria, and you have taken it for 2-3 days, you're not getting better, go to the hospital. You understand? If there will be need for the doctor to place you on antibiotics, the doctor will examine and know the type of antibiotics, because different systems we have in our bodies, they have special or peculiar antibiotics that they are made for. Do you understand? So you can follow me on this channel, and then if you have a question, you are free to drop your question on the comment box. You can also go on my Facebook page, and then you can also chat me up. My number is there. If you have any issues, consultation issue, you can also meet me up and chat me up on my or put it on the comment section, or chat me up on Facebook. I will reply you. You understand? Thank you, and may God bless you as you do the needful. Thank you.